during your exam you may get some of the question regarding hypoglycemia. So this is very important topic, and some of you guys get few questions from this section. So hypoglycemia means low sugar level. So how you find out? You will see a patient with diaphoresis, hunger, pallor, and shakiness. So diaphoresis means the patient is having excessive sweating, feeling lot of hunger, the body color change, and shakiness. So when you see this kind of thing, you assume that patient is having hypoglycemia. So if once you check the sugar, if their sugar level is less than 70 milligram, sometimes during your exam they may not give you like 70 number, they will give you like this kind of number, 3.9 mmol/liter. So you have to know both numbers. So if their sugar is less than 70 milligrams, then what you have to do, you have to give 15 grams of simple carbohydrate, such as half cup of fruit juice or 15 gram of glucose gel. Then you have to recheck their sugar in 15 minutes. And you can follow these steps times 3 times. 3 times you can do this. So you give, recheck, second time you give again simple carbohydrates, recheck, third times again you give simple carbohydrates and recheck, and fourth time when this is not working, if their sugar is still less than 70, the next thing is you treat with 25 to 50 ml of 50% dextrose IV. This is sugar water you have to give through IV if the patient is in hospital setting. If there is no IV or line equipment available, then treat with 1 milligram of glucagon. That's a glucagon IM shot or sub-Q shot that you can give. Treat with 1 milligram of glucagon sub-Q or intramuscular shot if there is no IV line present. If IV line present, then treat with 25 to 50 ml of 50% of dextrose sugar. But if no IV line, then treat with 1 milligram of glucagon sub-Q or IM. After patient recovered, once his numbers go up, then give complex carbohydrate and protein. Then last thing is, if the client is experiencing altered level of consciousness, then do not give anything by mouth. Bypass the oral, like don't give carbohydrates, he may get aspirate everything. So instead of that, you have to bypass oral, and then you have to give injectable glucagon or 50% of dextrose water. If the patient is at home and he has no IV line or no glucagon, anything available, then must seek medical attention. So again, go over one more time. During your exam, you will get few questions from this section, hypoglycemia. This is one of the famous topic for nclex. So again, you can give simple carbohydrates 3 times. You give it, recheck, give, recheck, give, recheck, then you jump to IV thing. Good luck.